Hey guys, and welcome back to the channel. My name is Ari, and hopefully you'll stick around for a quick video. Okay guys, so today I wanted to talk just a little bit about healthcare professionals and how healthcare professionals interact with trans people. And I do have notes, so overlook me if I look down at them. But I wanted to give 5 points that could make it more comfortable for a trans person in a hospital or a doctor's office, and help you be more understanding of a trans person's unique needs when they're going into a healthcare environment. You know, for anyone, going to the doctor can be scary and a little unnerving, and a lot of us get that way when we're dealing with sickness, illness, things like that. But it takes on a whole new level when you're dealing with all that and you're trans, because a lot of times healthcare professionals don't know how to properly interact with transgender patients. So I wanted to give 5 little things that healthcare professionals can do that are at least a good starting point in making their business, their medical practice, a more inclusive environment and more comfortable for patients who come in who may be trans or gender non-conforming. Okay, so step number 1 is to update your forms. When you're coming into the office, of course, we know that there is information that you're going to need to get from us. Things like insurance, legal name. We understand all of that. There are certain things that you need to know in order to look out for our health, as well as submitting things to the insurance company. However, it also can cause some difficulty when we're sitting in the waiting room waiting to be called in, and your forms are not very trans friendly, and it causes us to basically be outed to everyone waiting in that waiting room. You know, if someone who is trans feminine is sitting in a waiting room and their legal name was something like Doug or John, you know, having that called out when you walk out to bring the patient in can be an outing moment. So a simple update to your paperwork that could include preferred name and pronouns makes the world of difference in making a trans person feel more comfortable in your medical practice. It makes it so that they don't have to worry about being called the incorrect pronouns, or being called the incorrect name, or being outed to everyone in the practice. That could be probably one of the biggest impacts you could make right from the beginning of that first day that that patient registers, to let them know that they're in a welcoming environment. Number 2, don't ask unnecessary questions. I understand there are going to be times when you may have to ask questions of any person, trans or cisgender, that may be uncomfortable. However, if someone is going in for a head cold or for the flu, it's really unnecessary for you to know our entire transition history. You don't need to know how our family reacted to our coming out, or whether or not we've had or are interested in having a gender-confirming surgery. None of those issues are germane to the conversation or to the health care that's being provided. Of course, if there is something that a health concern that may be involving something in the genital or reproductive area, that may be a pertinent question to ask, but it is not for every single situation. So I think a lot of times what happens is healthcare professionals ask these questions out of a sense of curiosity, and I respect curiosity because curiosity is how you learn. But you're also making us incredibly uncomfortable in the process. What if you're asking about our transition and how our family reacted, and the way our family reacted was really bad? then you're forcing us to go back through and relive all of these experiences. And at the end of the day, those types of questions are more appropriate in the scenario of us sitting down with our therapist. It's not germane to, having an earache or a runny nose or anything of that nature. So don't ask those questions that you don't need to ask, that are not medically pertinent information. Number 3, don't make assumptions about who we are. Just because we're trans doesn't mean there's one cookie cutter transition method that we've all necessarily undergone the same procedures or the same treatments. We all are different with unique needs, and that needs to be respected. Every trans person who comes into your office has not necessarily had any sort of gender confirming surgery, and not all of them who come into your office even want any type of surgery. Not every person that comes in is going to have been on some form of hormone replacement. Some may be looking at it in the future, some may not be interested at all, and some may be medically unable to have hormone replacement therapy. So don't make those assumptions. Also, while we're on that, there can be this habit within the healthcare profession to automatically assume, and these are within bad healthcare professionals, not the good ones, but to automatically assume that because you're trans, you need an AIDS or an HIV test. That is not necessarily true. We will ask for the treatments that we need. We will ask for the issues that, we need help with. But every person who is transgender does not have HIV or AIDS or any other type of, STD. The fact of the matter is that there are trans people who absolutely do suffer from those issues. But there are also trans people who don't. There are trans people who are not at all sexually active. There are trans people who may be asexual and have no interest. There are a number of reasons, but don't jump to assumptions. Ask questions if you need to that are medically relevant, but make sure that you are not jumping to conclusions and making assumptions about who we are based simply on our gender identity. Number 4, be sensitive to our needs and our sense of modesty. Yes, there may be a medical situation that requires parts of us to be exposed that we are not particularly comfortable with. However, a lot can be done in the way that you deal with the situation. Help us, and allow us to kind of lead that situation. Be mindful of our modesty. Be mindful of the fact that a lot of things that may be just generally uncomfortable for a cisgender person can actually be dysphoria inducing for a transgender patient. Things that have to do, for example, with genitalia. There are, a number of us, not all, but a number of us that have dysphoria around that try not to even have to look or deal or assume that any of that is there so that we can function in our day-to-day lives. So the less attention you can bring to it, the more you respect our modesty in the situation, the better it's going to be for us, and the more confident we're going to be returning to you on a regular basis if medical care is needed. And finally, number 5, educate yourself on trans issues, trans identities, and transgender health care. The fact of the matter is that there's not a whole lot of training on trans patients or trans health care in your medical classes, whether that be a doctor, a nursing practitioner, any other type. They don't spend a whole lot of time teaching you that. A lot of that you're going to have to do yourself. And there are a number of places that you can reach out and get more information. There are, your state probably has medical associations or other healthcare providers or healthcare advocacy groups that can help inform you about trans needs in healthcare so that you can be more respectful to those patients and more ready to kind of meet the needs of the trans population in your community. Don't assume that we want to educate you about everything as an individual trans patient. I don't want to go into the doctor's office and have to explain everything about my identity and the process or problems that I may necessarily deal with as a result of those. I should not be, as the patient, your primary source of information. So reach out, research online, reach out to maybe your local college if you have a medical college or a medical school. They probably have something that can offer you continued learning. Touch base if there's a gender therapist in your area who could give you more insight on the needs of trans people in regards to health care. There are so many things you can do that will help make your practice more trans friendly. And if you can do that, the likelihood is that you are going to create a regular patient. That trans patient is going to be much more comfortable coming to you because they know that they're going to be respected and validated and that their concerns are going to be taken seriously. So please take the time to educate yourself on what that means in regards to trans health care so that you can be a better advocate for the people coming into your office. In closing, guys, there is a real problem with health care in the trans community. Aside from massive unemployment, which leads a lot to be unable to afford health care. A lot of places, their health care can be trans exclusive. That gender dysphoria diagnosis that makes it possible for you to move forward if you're looking at medical transition can also be the very thing that blocks you on insurance. There are fears about how we're going to be treated when we walk into a healthcare environment. So there are a number of reasons why there are poor health situations within the trans community. You as a healthcare provider have every opportunity to make a positive impact on that, to really help a community that is underrepresented and that has specific healthcare needs. So hopefully you'll take the time to educate, to look at some of the ideas, to do the updates to things like your paperwork, and try to make the practice that you're involved in a more inclusive environment. It won't just help your trans patients. It will help your entire staff. When people are in an environment where they know that everyone is respected, it is so much easier to work there. It can improve the morale of your office. It can help people walk away feeling that they're doing something positive for their community. So please consider doing that. Please consider looking for further information and expanding your own knowledge base. That's pretty much it for the video today. I hope you enjoyed. If you did, please take a moment and click the subscribe button. Give the video a thumbs up. Leave your comments and suggestions for future videos. I will end with my quote from Kesha. Don't let the bastards get you down. Be yourself. Be proud of who you are. Don't let anyone stand in your way. Until the next video, guys, that is it. Goodbye and lots of love.